Okay, I'm back. Sorry for the break. My network was actually bad, so I needed to change my location so we can continue. So I'm so sorry about that. All right, the last point was dissociative anesthetics. So I think we've talked about that already. You know that these are drugs used to suppress physical pains, and then it works with the perception of the brain. Now, on that aside, the next point is I told you there are seven categories. So the fifth category is narcotic analgesics. That's how we call this set of drugs, narcotic analgesics. Now, these are pain relief drugs. They create euphoria and then, create change your mood at some point. It is called is a pain relief drugs because you notice that sometimes you'll be having headache, very severe headache, and then just to take you know, one drug, and you notice that in splits of seconds the pain is already gone. So what narcotic analgesic drug does is it relieves you of your pains. Now, what I want to say about this is that sometimes some people are so attached to a particular drug because of the effects or because of the things they enjoyed from it. Okay, the other time I took the drug and I was having a headache and I noticed that it's gone. Another time I took it again, it's gone. So now you now narrow your mind to that very drug. So anytime you have headache, that's the same drug you want to take. Now, as you keep taking it, it will get to a point where your system start getting used to that very drug. That's why you see that you take any other drug doesn't work. It is only that very one. In a way, I just want to tell you that you're already addicted to that drug. Everything is here, is in the mind. You understand? So that's what that drug does. An example of such drugs are dextromethorphan. Dextromethorphan. That's what it does. And then the is bad. Okay. I think I'm back. Let me check. Thank you for bringing me back. I think I'm back. Let me be sure. Okay, I am. Thank you. So the next one is inhalant. This is another group of, you know, drug. It's another category. It's called inhalant. Inhalants are breathable substance that produces mind-altering results, you know, and effects. Breathable. You understand? Inhalants. You inhale it. You inhale it. And you know that. And then what it does is that it goes. Okay, I'm back. Sorry for the break. My network is bad. So to be sure that my people are still here, I need to tap here to check. Okay, I'm still here. Okay, I'm back. Sorry for the break. So inhalants are breathable substance that produces mind-altering results. You know, once you take it in, it goes straight to the mind, and you notice that there is a change in your perception and the way you think. That's inhalants. An example of it is plastic cement. Okay, sorry for the break. My network was bad. And then the next one, the seventh one is, I told you there are seven. They're categorized into seven groups. Next one says cannabis. Cannabis is a scientific name for marijuana. Yes, it's a scientific name for marijuana. Then the active ingredient in it is delta 9. So I had to take time to explain how the various categories or group of drugs works so that when we go into the main thing, you understand what I was trying to talk about. Now, as your drug use increases, you may find that it is increasingly difficult, very difficult to go without the drug. So when you're used to taking a particular drug, you notice that you can't do without it. And now, attempts to stop drug use may cause intense craving and makes you feel physically ill. when you are addicted to drugs, you know, and then that very drug is not there, what used to keep you firm, stimulates you, makes you agile and all that, is not there. You notice that physically you'll not be fine. And now we are going to go into that. So at this point, we are going to another good point. Causes of drug addiction. What are the causes? How did you involve yourself into taking drugs? How did you start it? Who introduced you to it? You understand what I'm trying to ask you? How did you involve yourself into it? Because there must be something that spurred you into joining it or into taking hard drugs. Something. So now we want to look at some of the causes, some of the things that makes people to, start taking drugs. The first one is environmental problem or environmental factor. Now, I'm going to talk to parents on this aspect. You know that there are some environments a child will grow, and that child will start living the life of that environment. Yes. There's environment you take your child, you groom your children, you notice that in one way or the other, the characteristics of that environment is beginning to play in the life of that child. For instance, your child lives in an environment where people take hard drugs at random. You know such environments already. We have some places that you know that in this very environment, drug intake is high. And the children are living there. They see these people every day. They meet them every day. They work with them every day. As in, if you're not careful, if you are not very, very, very careful, your child will end up you will notice that your child would start exhibiting some of those characters. Do you understand? Because in a way, they'll start keeping friends. You understand? They cannot leave the environment where they are living to go and keep friends in another environment. Your child is living, let me say, in Calabar. Yeah, you can't expect that child to go and start having friends in Abuja. They will definitely have friends within the vicinity. And you may not know the type of friends they're having. So environment also contributes. Now, 2, genetic. This genetic is dicey. Someone who asks, can somebody, inherit addiction, drug addiction, or become an addict or drug addict through the gene, or what is inside the person? Now, what I want to tell you is that there are some behaviors that trigger certain things. There's some behavior that triggers certain behavior. A particular behavior or lifestyle, or let me say, a particular lifestyle may trigger a certain behavior. What I'm trying to explain is that if you have anger, let me say, anger traits, or how do I even put it so I don't violate rules? You understand? You notice that the mother has serious or severe anger issue. The first child in the family has the same problem. The second child has the same problem. And then you leave that one and go to the grandparents. The grandfather or grandmother has the same issue. And then you check their children or cousins. They have anger issue. Now, the first thing that will come into your mind is that this family, there is anger problem in it. Now, I'm trying to make you understand how this is related. Now, people who have anger issue, there is this tendency and characteristics that they may do some certain behavior that violates societal standard. You understand? Or laws. When you are angry, you notice that you tend to do some certain things that on a normal day you will not do. So what I'm trying to explain to you is that out of anger, some people go into drug. When they are angry, you see them saying, give me 1 bottle of alcohol. I want to step down my anger. I'm so hot. I'm very angry, Now, they are not taking the alcohol because they want to take the alcohol. They're taking the alcohol because something is pushing them to. And it falls back to the gene. You hear them say, give me one, let me just bring out smoke. I want to bring out smoke because I want my system to be calm. And you notice that people, when they are angry, the next thing they look for things that will calm them. So the chances are very, very slim. The chances of not being involved is very slim. That's what that point is just trying to explain. And then the next point is, you notice that changes in the brain, repeated use of a drug changes the way your brain feels pleasure. You like taking a particular drug to suppress one thing or the other, and each time you take it, you're fine. Each time you take it, you're fine. It's just like somebody, let me just use the word love. You're in love with somebody, and then each time you have issue or you have needs, it is the person you're looking for because that's the person your heart is going to. That's what happens. That's example. That's exactly what happens with drugs. So now when your mind is used to a particular drug and you don't have it in your bag, in your purse, in your first aid box or wherever, you start feeling very uncomfortable. That is because the pleasurable part of your brain is always telling you that you need this thing, you need it. This is how it starts. Don't worry, I'll get to the point we are looking at. Now, the next one is mental health disorder. We're looking at the causes. What makes people go into drug and why they take drugs and become drug addicts. Mental health disorder can make you become a drug addict. Maybe you have a problem mentally and then there's a particular drug that puts you together. I've already explained that. You see yourself always taking that drug. Sometimes there may be other side effects of that drug, but because this is what puts you back, you fall back to it. You're already addicted to that drug. Now, the next one is peer pressure. When I posted the flyer I made the notice for this program, I told you we accommodate children from 9, teenagers, adolescents, adults, and the rest. Peer pressure. Do you know that children are taking drugs and they don't know the implication of what they are doing? So I'm talking to parents right now. They are children who are involved in one way or the other taking drugs. They don't know the implication. They don't even understand what they are doing. Why? Because of the people they move with. Peer pressure. They will see their friend doing it. I saw my dad drinking it, so I took one inside my bag. And when they now met, they're experimenting it. They took it the first day, took it the second day. They continue, they keep on doing it. And then, remember, it is drug. And some are very, very addictive. The child may not want to take it, but because he started taking that drug and it has registered somewhere that you need this thing, you did not take this thing, you see them falling back. Some drugs are very addictive. So parents should check the people their children are moving with. Peer pressure will push your child into doing something else. They will not like this, but because they saw their friend, they have joined. That's how it starts. That's one of the causes now. Is there any other thing? Okay. Now, the next one is early use of drug. Early use of drug. By early use of drug, I mean there are some drugs that are not for children. Those drugs are meant for adults. You hear some adults saying, when they prescribe the drugs for me, the pharmacist said I should take one. So I took one. So since I am an adult, I took one. She is a child, break it into 2 and give the child half. Now you have self-medicate, which is very wrong. You are giving a drug that is meant for an adult of 30, 40 years to a child of, let me say, 12, 13 years. You understand? It's wrong. Now, what it means, early use of drug, what it means here is that the brain has not fully developed, though. Forget that there is a child. From the womb is out, we know. But that child the brain has to develop and grow to a certain stage to get used to that very drug you're giving. Now, it's more of abuse. It's more of abuse. So the child now, what that drug does to that child is that it will start getting used to that child's brain. And the child grows with that. If you notice some children, there's some children that you give ordinary I don't want to mention any drug so that I don't go contrary. Pain relief drug that you give to other children, it works. You notice that a particular child you give that drug, it doesn't work. Have you ever asked why? Sometimes it is because the parent introduced that child early to a more heavy or hard drug. That's why it doesn't work. That's why you see some women, when they go for CS, you hear the doctor asking you questions like, do you take alcohol? Do you know why they're asking? Maybe the quantity of the drug they have, injected into your body is supposed to take you for that process and bring you out. But it's not working because the drugs you have been taking has taken a greater part of your body that nothing sinks easily. Those things don't get stable easily. You give a particular person a kind of a sleeping pill, the person sleeps immediately. Some people can take 10, they are not sleeping because their body is used to hard drugs. That's what that point means. Now, the next point is taking a highly addictive drug. Some drugs, such as stimulants, may result in addiction because of how it works and produces fast results. You see why I took time to explain the categories of drugs so that I will not have to go back or digress. Now, stimulant, what it does is that it stimulates the body, and mind you, the stimulant you're taking so that you'll be active in doing your bricklaying work or in packing your things or in stocking so that it will give you energy. In a way, has another implication, meaning that you may have S dots. I don't want to pronounce the word S dot E dot X. If you join it, you know what it means. S dot E dot X. You notice that you start having urge for S dot E dot X. Now, when they discover that this very drug I took, this is how I felt, or this was how I felt, this is what it did to me, they will now beckon on that very drug. You notice that anytime they want to go to the S dot E dot X, they will now have to take the drug. Most of the S dot E dot X drugs are stimulants. So now you're taking it, you're enjoying it. It will get to a point whereby if you don't see the stimulant, S dot E dot X will not take place because you will not function well. Do you know why? Because that part of your brain has been carried away by that very thing. So what the brain needs at that point is that very thing. So you have to satisfy it. In the course of trying to satisfy it and satisfy yourself, making yourself happy, you have become a drug addict. Now, let me know. I think I've mentioned so many points at that, Now, the next point is signs of drug use and addiction. How do you know people who use drugs? How do you know the signs that this person is becoming addicted? Number one is physical health issue. Lack of energy and motivation. Weight loss and gain. They start lacking motivation. You notice that if you have a child as a parent and your child was doing well, and the child has John bad gang now and they are taking some substance, that child will not do well. I don't want to use the word may. Sorry about that. So that I will not encourage parents to say may. No, I will not. Because in a way, that thing will affect that child. Lack of energy and motivation. Before they used to go to classes, they will go for prep or they will go to read. They don't go again. Because they are already seeing that time as waste of time. They want to go to the corner where they used to take the drugs. That's what they want to do. What the child wants to do. And you cannot be at the corner taking the drugs and then functioning well in school. It's not going to work. Because academic work is, you have to be there. You have to be engaged. You have to hear directly from the horse's mouth. So however intelligent the child is, that child will miss at some point. Now, the next sign you see is problem at school or work. Problem at school or work. They will give you a particular work to do in the office. You have not done it though. Do you know why? when you came to the office in the morning, you have stopped by to do one or two things, and now you're struggling to meet up with deadlines. You even have problem because you'll be making series of mistakes. If you were in the finance or account department, you notice that you'll be making blunders because your brain is now relaxed. It's not active the way it used to. Those are the signs. And then the next one you notice, neglected appearance. They start looking, they lack interest for so many things, in clothing and then their looks. They don't take care of themselves again. They can just wake up, wear anything. When you see somebody who is addicted to drugs, that person is not coordinated. As he's waking up in the morning, the next thing what he wants to do is to rush. Is to rush. The person wants to rush, he wants to run and go to take one shot first. You understand my point? He wants to run and go and do something first. So they don't look good. Neglected appearance. Some of them, when they get to the place, the weather is high. Okay, thank you for bringing me back. Now, they look different. They will stay there and take it, pull their shirt. You see them sweating. Now, when they are hurrying to go to work or to school, they will rush. You see them. Okay, I think I'm back. My network has been so stressful. I may not take much time again because the network is bad.